O'Hare to downtown. Trip time is 38 minutes. The express lanes are now quicker. There was a crash there to Ogden. Inbound Eisenhower, 45 minutes, 390 to downtown after a crash at 25th. Outbound, 35 minutes after a collision at 83. Inbound Stevenson, it's 33 minutes, 355 to Lakeshore Drive. Southbound 55 is heavy after a crash at I-80. That's traffic. I'm Jim Palamonte on AM 560, The Answer.
Chicago's Morning Answer continues next in our AM 560 Weather Center. Clouds and sunshine today. Winds kick up this afternoon to around 30 miles an hour in spots. High 32. Windy overnight as well, and a low of 29. 13 at O'Hare, 17 along Chicago's lakefront. Your next news update is at 9. Breaking news as it happens. Chicago's Morning Answer with Dan and Amy continues next on AM 560, The Answer.
From the Matrix Home Solutions Studios, this is Chicago's Morning Answer on AM 560, The Answer.
Listen to AM 560, The Answer, online at 560theanswer.com, on the AM 560 mobile app, and your Alexa-powered smart speaker, on TuneIn, iHeart, and radio.com. Only the biggest stories, only the biggest guests, and only the biggest opinions. This is AM 560, The Answer.
Good morning, Dan and Amy. A working paper posted over at the National Bureau of Economic Research from academics at Harvard, Duke, and Johns Hopkins concluded there could be around 1 million excess deaths over the next 2 decades as a result of the lockdowns. For the overall population, the increase in the death rate following COVID-19 pandemic implies a staggering 890,000 to 1.37 million excess deaths over the next 15 and 20 years, respectively. The paper suggests that the deaths caused by the economic and societal decline as a result of lockdowns may, quote, far exceed those immediately related to the acute COVID-19 critical illness, which, as we know, according to the government stats, is at 400,000 plus now. The recession caused by the pandemic can jeopardize population health for the next 2 decades. We tried to talk about this. I mean, we didn't try. We did talk about it. Not a lot of people are paying attention. Certainly those decision makers, and particularly those who live in the fantasy land of a world without trade-offs, talked about the research we know in terms of the public health effects from recessions, not even necessarily pandemic related, just recessions in general. So when you induce a deep one, expect the same public health consequences. And this one obviously much more profound because the lockdowns obviously impacted people not in the workforce, like kids. The authors also note, quote, based on emerging data, it is likely that the limited access to health care during the lockdown for white people by north of 2 years for blacks and Latinos. How about that for trade-offs? Nobody was listening, and forget, conservative like me, like this show. Of course, you don't listen to them. We don't know anything. But nobody listened in October when the World Health Organization's regional director for Europe, Hans Klug, said government should stop enforcing lockdowns unless as a last resort because the impact on other areas of health and mental well-being more damaging. In October, David Nabarro, the WHO's special envoy, we talked about him. We presented what he had to say. We do appeal to world leaders, stop using lockdown as your primary control method. Well, I guess Lori Lightfoot and J.B. Pritzker and St. Andrew of COVID-19 and Gavin Newsom and the Ava Perone of East Lansing and Phil Murphy in New Jersey, I guess they just don't constitute world leaders, so they're exempt. Maybe that's how they explain it. In San Francisco, 3 times as many people have died of opioid overdoses as have died from COVID-19. A city that is locked down in a state that is locked down. 3 times as many have died from overdoses as from COVID-19.
People are depressed, and there's no end in sight. There's no hope. And these politicians have brainwashed people to think, fearing the disease, but also changing their livelihoods. And there's, again, it's severe depression, and it's happening here in Illinois, too.
For more on this, we're pleased to be joined again by Dr. Kevin Pham. He is a medical doctor, which is why I call him doctor. Contributor to the Daily Signal, former graduate fellow in health policy at the Heritage Foundation. Dr. Kevin, thanks for joining us. Appreciate it.
Thanks so much for having me back.
What about that? The continuing number crunching and the continued modeling and the continued scientific research. Oh, the science isn't settled. In terms of understanding the impacts of the policy choices that have been made, particularly the impacts of the lockdown and the lockdowners that isn't talked about. And this against the backdrop not just of a persistence in this country, but in the West generally, including with some British officials talking about the lockdown they're under now, get used to this well into 2022.
Yeah, all of the evidence that we've been looking at shows that lockdowns don't really do anything. When we're looking at we're comparing, well, they don't do anything for what we intend them to do, which is to prevent the further transmission of COVID-19. These lockdowns have been completely ineffective as a solution to preventing COVID-19. Now, if you look at the cases back in March and April, when we first instituted the 15 days and then followed that with the 30 days, so 45 days total, we did hit a peak and then a sustained decline in cases. And so I think for that short period, we were able to rally and then really hunker down. And then I think that actually helped. But the problem is that was always a tactic, never a strategy. And we're seeing governors and world leaders decide to use lockdowns as the overall strategy, and we're just not designed to do that. I went home for the holidays, and I saw personally that even in my own life, even people who were pretty normal and pretty well adjusted, they're starting to have major effects to their mental health, and it's pretty bad.
Yeah, well, the suicides, we're up 6 from last year, but they're mostly high schoolers who just want to get back to school and get back to sports. And again, there's no end in sight. There's no end date. They have no hope. And that's a big, big problem. And our politicians don't see that the kids need to go back to school and to play sports. They need their lives back.
They absolutely do. Especially at that age. People are the most social at that age. And our social interactions are sort of what grounds us to our community, grounds us to our reality, the actual world that we live on. And when you start severing those connections, those social connections, you start losing your tether on the world itself. And then in psychiatry, that's what's called derealization. It's when things start to feel like they're not real, and you lose that reason for living, and that's driving. There hasn't been research done on this as far as I've seen, but that derealization, I think, is what's driving the rise in suicide, the staggering rise in suicide these days.
The incoming CDC director saying over the weekend that things are going to get worse over the next several weeks. We have some dark weeks ahead, is what she said. So how should people take that statement? How should they understand it, and what should they do in response to that statement? Is there anything they can do other than queue up for vaccine distribution by however it's being distributed where they live?
Frankly, I don't even know what to take of that situation or that statement. Because I'm looking at the COVID numbers over the past several weeks, and they were getting worse over the early winter, but we seem to have hit a peak in the number of hospitalizations, which right now is probably the most reliable figure that you can use because there's decreased testing over the holidays. But there's been a week and a half sustained decline in the number of hospitalizations, so it seems like things are actually getting better. For what people can do, I think is just try to get those vaccines. I'm finding out that a lot of clinics are allowing for vaccinations for people who were originally scheduled to get vaccinated, but they missed it. And they have some clinics have a will call. Places like Walgreens and CVS may have a will call or a standby list for vaccinations. And I would get one. I signed up wherever I could, but I would get one if you can. I think that's that the time frame of when these vaccines were authorized is showing the impact right now with the sustained decline in at least hospitalizations.
Well, what about after you get vaccinated? Why do you still have to wear a mask? Or do people just really don't know the science and the data yet?
That's what CDC is saying.
Right.
All right. Wearing a mask, they're sort of saying that as a as a metonym for just take general precautions. And the reason for that is because it takes for that 95% effectiveness that we've seen from the vaccines, it takes 1 week after the second dose, which is 4 weeks total. So people do need to be careful around COVID-19 for several weeks after your first injection. And I also say that immunity is not invincibility. So even if you were hit with a high enough viral load, then you would still be able to get sick. It's pretty rare. It's pretty unlikely, even with that 95% effectiveness. But still, it's helpful to not try to get yourself in a situation where you may become infected. But that having been said, after those 4 weeks of vaccination, then you should have a pretty good level of immunity that should allow you to resume basically your normal life.
Can I read you some mitigation strictures from Chicago and get you to comment on the science behind them, if there is any such science? Restaurant and bar. I'll give you a couple examples. Restaurant and bars. Outdoor services allowed, including tables within 8 feet of walls that are at least 50% open. I'll let you work that in your head. Just visualize that. Outdoor service, tables within 8 feet of walls that are at least 50% open. Indoor events of 10 or fewer can resume if food is served and only in locations that are designated and typically used for private events only. Face coverings at all times and so forth. And they must close at 11 p.m. May reopen no earlier than 6 a.m. I guess COVID sleeps between midnight and 6 a.m. or 11 p.m. and 6 p.m. Health and fitness centers, 25% capacity indoors. Group classes of 10 or fewer can resume under the 25% capacity. Reservations no longer required. Locker rooms can reopen under capacity restrictions. Face coverings. Movie theaters, indoor 40% with no more than 50 people in any one state. Retail stores. Grocery stores and pharmacies can operate at 50%. All other stores at 40%.
Oh, come on.
Museums can reopen at 25% capacity. Guided tours are limited to 50. Groups are limited to 10. Guided tours different than groups. Okay. Personal services, 40% capacity, no more than 50 people. Indoor recreation, 25% capacity with no more than 25 people. All that stuff, check with the science and the data that we have culled together over the last year about this.
That 10% between 40% and 50% between whatever they're doing, that 10% is very essential and very none of this really makes a lot of sense. Yeah, like there is a general principle in that if you try to avoid crowded areas full of strangers, then you're probably doing fairly well. And beyond that, these numbers that they're coming up with, they're completely arbitrary. Why within 8 feet of a wall? Like why exactly is that? Why not 6 feet of the wall? Like it doesn't make a lot of sense. And the problem is that these government bureaucrats are the ones coming up with these completely arbitrary numbers. They should really let the establishments dictate, or at least try to determine for themselves what is safe, with some principles that come from public health. But at this point, public health officials have completely shot their credibility, so that's going to be difficult too. But we all know how a respiratory virus is transmitted. We should trust people to take care of their customers, take care of their visitors on their own, because at this point, the rules are mind-boggling. The time limits are completely nonsensical, and at this point, it's all theater. It's pandemic theater now.
Thank you. Dr. Kevin Pham, medical doctor, contributor to the Daily Signal, former graduate fellow in health policy at the Heritage Foundation. Dr. Kevin Pham, thanks for joining us. Appreciate it.
Absolutely. Thanks so much.
Thank you. And he joined us on our turnkey.pro answer line.
You've made the switch, and it feels so good. You've switched to Chicago's Morning Answer on AM 560. The Answer.
If you're drowning in IRS debt and